Absolutely. Right after the storm, there was an influx of community and federal and state resources that came into the area to try to help and support in all of the schools. And while that was wonderful, it was one of those we didn't know what we didn't know. And as those supports faded out, the needs of the students were still there. Our mental health team at the time was very small, and they were trying to triage this influx of students that were now dealing with traumatic events from the hurricane, many of which lost their homes and everything that they owned, had moved 7, 8, 9, 10 times. I know at Beach Elementary, we gained more than 100 students in a very short period of time. So anything that was normal didn't exist. On top of our faculty still dealing with the traumatic events themselves. So that was kind of where we ended the school year, was everybody just trying to provide any supports we could at the school level. Our providers, right after the storm, announced that they were about down 40% of their capacity. So the typical schools that would have counselors at schools were down providers, so they weren't able to receive that school-based counseling or therapy during that time either. So it was everybody doing what they could with the resources that they had. The community-based providers have been able to do some hiring. They have been able to add some additional faculty and staff to their teams. However, lots of them are still down people, which means we're down providers for our kiddos to see, and that's putting kids on a longer periods of time. It's putting kids on wait lists for some of our organizations, and we're really trying to shift our resources to wherever we can get the kids' immediate needs met now. The providers are wonderful. They're doing all that they possibly can. And within our mental health team, we are growing. The mental health allocation budget does allow for us to add a few additional people to our team. But with 38 schools across the district, there's no way to put a person in a school every single day. We're a team of 4 licensed clinicians, so that puts a very limited face-to-face time in schools directly with kids. And while the guidance counselors are fabulous, the guidance counselors are then also dealing with testing and immediate needs of their school, where they can't always be with Johnny or any student at the same time during the same place for a week like you would do with any kind of sustained therapy. So ultimately right now over the summer, we haven't stopped working, we haven't stopped triaging any of these. So the students that we were able to refer for services, we're still able to confirm with the agencies that they're in services, which is fabulous. We know how kiddos are doing, who's discharged, what the barriers are. Any students we couldn't reach for a variety of reasons, as you all know, the cell phones changed 1.5 million times, or addresses changed. The Department of Education has been graceful enough to send teams to the Panhandle, and for the next, they were here last week and they'll be here for 3 additional weeks. They're helping us triage that. So this week we have social workers here. They're able to reach out to families, make some phone calls, and they're getting very positive feedback from the families they've been able to reach. Thank you for calling. Thank you for caring. And they're listening and they're taking that whole child approach and the whole family approach. So if it's housing, they're able to hook them up with whatever the local resources are for housing. We're able to talk about Mercy Chefs. We're able to talk about the feeding sites that are happening for bay-based programs. And they're able to really get the whole picture of what's happening within the families. The ones that they're not going to be able to reach, we're actually going to do some door-to-door, let's go see what's going on and how do we meet the needs of this family. Because with school still being out for another month, our fear is that as trauma gets worse over time, it's not something that can be done or dealt with in a shorter period of time, and we don't want to have that sustained trauma. And what I've been told, and my background's not in mental health, is that 1-year anniversary historically for storms tends to be a very pivotal point on the trauma for the poor kiddos and our community not getting any better. Like they predict it to get worse before it gets better. So we have been able to get some funds from a SERVE grant that we did receive that the First Lady announced at the fire station. So we're going to be able to add hopefully 8 social workers. What we're trying to do is partner with Florida State to get some of the providers that are not directly in the area, because what we don't want to do is take from any of the providers who are currently seeing kids and put them in the same capacity, but just under a different organization. What we're trying to do is build the capacity of the community and build the team so that there's more support for our kids out in the community. We're hoping to see if we're able to do that. We're also going to be able to put some para support for the guidance counselors in the schools with this SERVE grant to hopefully free up time for the guidance counselors to have more face-to-face time with kids. That's the ultimate goal, is to get more adults having face-to-face time with kids, build those relationships, identify those problems. And they're not always the kids that act out. Sometimes it's the quiet ones in the corner that we need to keep an eye on, that we can provide those supports to. And with more face-to-face time, we're hoping that that can happen. We were excited to learn, as you guys all did at the fire station, the announcement of telehealth in all the schools when the school year starts. We don't exactly know a whole lot about that yet. We've been working with the installers to try to, the equipment I believe gets delivered next week or the week after, where that's going, the logistics behind all of it, how mobile, who the provider, those sorts of things have not been ironed out. So at this point, while it's a great resource in all of our schools, getting that up and running and making sure that that's all completely 100% going to fix it at the beginning of school. Right now, I can't answer that because we're still trying to kind of iron that out. We do have pain care in quite a few of our schools, which provides that service as well. But again, you're talking about a screen monitor telehealth system and not the additional capacity of that face-to-face contact with kids. So those are all the things that are kind of in the works right now. Ultimately, I would love to see a provider in every single one of our schools every single day. The long-term plan is about $30 million. It would put licensed folks in every single one of our schools over the next 3 years. It would allow for the sustainability of our community to build back their resources, because that's their ultimate job, that's their training, that's their love, that's their passion. But it would allow us to provide the supports for our faculty, and for our kids and our families in the school setting, and then refer them to the outside providers when that's appropriate.